Good afternoon and welcome to the Texas Association of Builders Virtual Education. In today's session, we'll hear about one of TAB's newest member benefits featuring business and personal insurance solutions tailored to your needs. This webinar will provide you with information about some great insurance business solutions. Texas Association of Builders has partnered with Mylo, whose licensed advisors will help you assess your company's needs and guide you through your insurance options. Today's panel is led by Catt Webb. She is the Senior Vice President and Head of Strategic Partnerships with Mylo. Before we get started, I have a few housekeeping items. If you have questions, please post them in the chat box at the bottom of your screen. And this session will be made available via TAB's YouTube channel, where all of our no-cost education is available to you. Catt, I'll turn it over to you.
Awesome. Thank you so much. Hi, everybody. I'm Catt Webb with Mylo. Let me go ahead and share my screen so we have some slides that we can go over together. There we go. Awesome. So again, thank you for your time. We'll have three people discussing and diving into some of our products today. I'll go over and introduce them briefly in a minute. But just to kind of get started, obviously Mylo is a newer partner for TAB. We are our insurance solutions. We have multiple products that we'll be going over today, but ultimately we'll be really diving deep into the small group benefits, health, and Medicare space, which is why Sandy and Courtney are on the call as well. Feel free to ask any questions during the presentation, and then also know that this presentation will be available after the meeting. And then, of course, if there's anything that you need to follow up with individually with myself, Sandy, or Courtney, you can definitely get a hold of us that way. So just to mention myself, I've been with Mylo 5 years. I really lead our strategic partnerships. So we really focus on partnerships like TAB, associations, and other businesses who have customers that have a need for insurance and really leverage our platform to accomplish that. And so I've worked with, yes?
Do you want to go to presentation mode?
Oh, I thought I was. Can you see?
We can see your slides.
How about that?
Oh, yep, perfect.
Good?
Yep, sorry,
Okay.
Thank you.
No. So, really I'm just working with a lot of the executive officers and the presidents and the local HBAs to discuss how we can bring the Mylo solution to you guys. We also have Sandy Kenslow, who is our VP and Director of Small Group Benefits. She has over 25 years of experience specifically in the small group benefits space, which really ties neatly into a lot of the TAB members. And so we'll touch on a lot of things and common questions around that. And then, of course, we also have Courtenay Brummer, who is our senior health consultant. Courtney is phenomenal, specifically in the Medicare space as well as the health insurance space, and really helps guide people into making the right decisions and navigating the confusion of the health market in general when different scenarios are coming up. So you'll hear from them later in the conversation. So as mentioned, Mylo is, TAB's digital insurance partner. We have multiple agents at your avail where you can call or interact with us via a website, your choice. And again, really specifying and meeting the needs of home builders and contractors alike. Just in general about Mylo, because you probably have never heard about Mylo outside of this relationship through TAB. We do have over 50 years of experience. We're actually a part of Locked-In, which is the largest privately owned brokerage in the world. And so we do work and leverage with them. Mylo stands for My Locked-In. We are focused on, the future and leading technology to help make quoting easier for business owners because, it takes a lot of time and we want to make sure that you're getting the right advice. So we're really trying to focus on how we can help small businesses specifically make this process easier, faster, and quicker. But ultimately we have access to the top rated carriers like Nationwide, Liberty Mutual, Arrowhead, Progressive. I mean, you name it, we pretty much have access to it. And we really make sure and pride ourselves on getting, top A rated financially strength carriers, just to make sure that if there is something that comes up or happens and there's a loss, there's never any issues with, when you really need that insurance to come through. As mentioned, we have a ton of products on our platform. I will highlight a couple of them today, but again, we'll be diving into the small group benefits and health space. But just as a reminder, we have home insurance, auto insurance, anything kind of on your personal stripe, we're able to assist with. Of course, we have the business insurance, and so anything that you need related to your business, like workers' comp or BOP or GLs, we can also help you with. Life insurance needs as well is something that we have in addition to that we'll talk a little bit about, but again, really focusing on anything and everything that you need so that you don't have to maintain multiple relationships. You can really come to one location and get all of your insurance needs resolved with us. As mentioned, we have a ton of carriers. We are a broker, which means that we're not tied to a particular brand. So we're not going to be pushing a particular product. And so we're really like shopping the marketplace for you, especially in Texas, depending on what area you reside in, Houston, and some of the coastal areas, we definitely have solutions there as well that can sometimes be a challenge. But again, just really focusing on those top rated carriers and having access to over 200 to really make that shopping experience seamless and easy. And you're not having to go and get multiple quotes from multiple people. Again, I'm going to touch a little bit on the commercial insurance space. Again, really focused in on the small business owners. And so some of the products that you probably are familiar with around that is just, if you have a property and you need to insure anything around that, or general liability when you're building around different plans. Obviously we do also do workers' comp, but we can do commercial auto. We have cyber insurance, commercial auto. So again, we can really round out a nice package for you and assist you with anything that you need. Even if you have some of the current carriers that we have listed, if you haven't shopped in a while, might be a good time to kind of compare and have your coverages reviewed to see if your business has changed, grown, added new employees, purchased new properties, increased your revenue, things like that. Want to make sure that you're covered in case there's any exposure from that perspective. So we can definitely assist there. In regards to personal lines insurance, again, this is focused on home, auto, umbrella, and other items that you would need to insure, but we can assist here as well. We have a digital quoting tool that you can go online and get quotes. So if you are just interested in seeing what's going on, you can kind of go to our website, and it's co-branded with Tab, of course, and you can see what's going on. Or of course, you can reach out to myself and I can assist you through that and get your quotes ready for you. And we have actually had some success, helping some Tab members save money as well as increase their coverage. That's really what we're trying to do is bring those solutions and help ensure that you're covered appropriately. And then the other thing just to mention is life insurance. We do have access to life insurance. This is actually one of the products is pretty great. We can do what we call instant issue up to $1.5 million. So for instance, if you go online or even talk to me on the phone and, it can take like 10 minutes, we're able to issue out life insurance policies with no no paramed, no underwriting skills, as long as there's, certain health questions that are answered correctly that don't require it. So it's a really easy and fast way to get some life insurance coverage, whether it's for yourself, for a family member, or even for a business partner. For Keyman Insurance, we can help with any of those very quickly in a digital format. Again, trying to alleviate how much time you spend trying to get these products that you need. But of course, if you need more than that, we can assist you via phone and take it from there. So it's really up to you on how you want to interact with us. You can call us, you can email us, you can go to our website. Again, it's just what is your convenience level and what are you trying to accomplish so that you can go and carry your focus into your business versus insurance. So with that, as far as before we get into the small group benefits, and I'll be handing it off to Sandy, wanted to kind of pause with those products that I've gone over so far and see if there's any questions that might be going on.
No questions so far.
Okay. So one thing I'll bring up too is we have actually sold a few home and auto policies to Tab members. One of our first ones, we were able to save him $4,500, so $4,500 for the year, and we were able to increase his coverage. He hadn't shopped the market in a while. He definitely had some good coverage when we were reviewing it, but the fact that we were able to actually save him $4,500 for the year and increase his coverage was a pretty successful win. Obviously, we'll never, I can't promise that I'll always save everybody money. I don't want to come off like that's the case, but most of the time, especially if you haven't looked at it in a while, we're usually really successful in helping people navigate that, which is a pretty significant savings if you ask me, especially in just the home and auto space. So just sharing some examples of some wins that we've had with recent tab members, and we've been sharing some emails and newsletter content with the specific members who are willing to give quotes just to kind of help you guys see that this is really happening, and which local HBAs that we're able to assist with these products to really try and make sure that you see the value in this program. So without further ado, what I'll do is hand it off to Sandy. Sandy, as I earlier introduced, is our VP of Small Group Benefits. So, this has been a very hot topic for tab members. We've had some great referrals, some great conversations, a lot of questions around this space. And so we wanted to make sure that we could bring the experts in here and kind of go over what we've been doing, what successes we've had, and kind of go over some common FAQs as well to see if there's anything that we can assist you with. So, Sandy?
Thank you. Good afternoon, everyone. I'm Sandy Kenslow, and I am the Director of Small Group Benefits here at Mylo. As Catt mentioned, I have over 25 years experience in this specific industry, and I joined Mylo 2 years ago because I'm passionate about finding ways to help businesses have a better benefits experience. And that's one of the key things for Mylo, is helping folks get good advice and understand what they're buying and why they're buying it and how it works and how it's going to help them. And I think that is something that is key across all of our business lines, but I know specifically in group health insurance. Not everybody loves insurance, and I'm one of those folks that kind of geek out on it. And so I really enjoy being able to help businesses find the solutions that they need. So for us here at Mylo, our small group benefit solution is specifically designed for businesses between 2 and 99 employees. So we bring technology, and businesses often cannot either source that kind of technology, or it's not really affordable for them. So we like to bring some things to the table for our small business owners that will help them be more efficient. It's going to help you be digital. It's going to help you be paperless, which is becoming more and more important. It also allows for employees to engage with their benefits in a way that is more familiar and is, frankly, the way our society is going. We like to engage digitally. We like to have apps. We like to be able to have on-demand access. And so Mylo will bring technology to the table to you as a business owner, not only when you're reviewing options and looking at shopping for processes, but also online enrollment, year-round support and service, and a couple of different ways that you can interact with our enrollment platforms. So that's a big key for us. What we offer, as far as, I think someone I'd already seen a question about what is the minimum and the maximum for employees. 2 to 99 is a very broad range for us to work in. And so what we want you to also know is that we have benefits advisors who specialize in the different market segments, because your needs are going to be different. If you have more than 50 employees, you have different laws that you have to comply with. You have different compliance aspects that you're going to need guidance and advice around. If you have fewer than 20, you're going to be looking at things like, do I offer COBRA? Do I not offer COBRA? And so we're here to grow with you as a business owner. So if you start out and you've only got 4 or 5 employees working for you, and you start growing and adding, we're going to be working with you and keeping you apprised of what's coming down the road. What are the next strategies? We're going to be looking ahead with you. So we do have benefits advisors that specialize in working with business owners that are in those smaller markets. You often do not have full-blown HR staffs. You're wearing all of the hats. You're doing everything. You're trying to pay all of the bills, enroll everybody, keep track of payroll. And so we know that those are things that you're going to need help with, and we can bring some technology for that. So I did want to address, in Texas, we offer United Healthcare, Blue Cross Blue Shield of Texas. We have some regional carriers like Scott and White. We will also have, as you go up market, depending on how many employees you have, you might have access to Aetna, to Cigna, some of the larger groups that will work in a self-funded platform. For good old things like dental and vision and life and disability, we have carriers like Delta Dental, VSP, Guardian, Principal, MetLife. So well-known established carriers that are going to give you good coverage no matter where you might be traveling. In Texas, maybe you have children you're covering that are out of state at college, things like that. It's important to have good networks and nationwide networks. So we make sure that we bring those carriers to the table and we have conversations around that to make sure we're making good recommendations for your employees. For those of you who might be considering offering benefits for the very first time, I just wanted to share a couple of key points because there's a lot of moving parts when it comes to that. So first off, general to all states and not just Texas are going to be things like participation and contribution. So participation is when a carrier is telling you that in order to set up a small group benefits plan, you have to have at least 50% of your employees who take the coverage. So that's the first key thing to understand is how many employees do I have? How many are interested in taking the coverage? And do we think we can actually set up a group plan? After that is the contribution. So part of what makes group insurance is the employer helps contribute to the cost for the employees. You are not required to pay for anything for dependents, spouses, or kids. That can be 100% employee paid. The only part that a business owner would have to contribute toward is the cost of the employee's single premium coverage. So that is something that you want to be thinking about as you ponder whether or not to start a group benefits plan and try to help set out a budget for yourself. We can also work with you on setting budget parameters, and we'll show you a couple of slides here in a bit, some of the tools that we use to help with contribution setting. Outside of just, can I get a group plan going? Next, it's like, yes, now we've picked our plan and we have to administer and we have to follow some compliance. Just setting up a plan is going to be the first step, but there are rules and regulations that follow with it. So you want to be prepared specifically to make sure you've got a commitment to the administration of it. You know, things like paying timely, making sure your employees are getting added timely, and if they leave you, that you terminate timely. That's a big one for Texas. So my first bullet point on this slide is Senate Bill 51. This is big in Texas, and it is intended to protect the employee who might be leaving employment and has not elected their state continuation or their COBRA, or they're leaving, you know, really close to the end of the month and they didn't realize they needed to elect those things right away. So Senate Bill 51 simply says, if you, the business owner and employer, do not tell the carrier that this employee has terminated, then you are going to be responsible for those premiums on a go-forward basis until the end of the month in which you do tell the carrier they've gone. So if somebody is leaving around the 15th of the month and you tell the carrier on the 20th, that's fine because coverage will go to the end of the month and it terminates off. If you were to let an employee go or they were to quit and it's around, you know, the 28th, 29th of the month, according to Senate Bill 51, you basically have 3 days to notify the carrier. Otherwise, you'll be charged another month of premium. So in small businesses, it makes a difference if we're getting extra months of premium charge that we were not planning on. So that's just something to keep in mind for administration. You will need to be a little bit on the ball when it comes to that and mindful when you are terminating employees. Another big question that we get, husband and wife spouse only groups. So Texas and Kansas are two of the states that actually recognize husband and wife groups as eligible for group benefits. So we technically can do a group of one in Texas. So if you and a spouse might be the only ones on your articles of incorporation, we can actually set up a plan. And I did verify this again with United Healthcare and with Blue Cross yesterday, because it is a state law for Texas. They have to comply. So you can do what's called a one life group and get set up. You have to provide things like your copies of your articles of incorporation. And that will go toward establishing that you're a legitimate business, that you have a federal tax ID number, and then the carriers can issue from there. So what is the benefit of doing a one life group? I would tell you that if you're considering and weighing out, do I go with an individual plan or do I stay on a spouse's plan or do we set up our own plan? One thing that you do have access to in group insurance are national networks. Typically in this, the individual and family market, if you were buying through something like healthcare.gov, you're going to be looking at local networks where you don't have coverage should you be traveling out of state. So that is typically one of the highlights that people are looking for group insurance, is because they want access to those national networks. Outside of that, maybe they're looking for, we'd like to be able to write off the premium. So what I would tell you is check with your tax advisor, because it's my understanding that should you buy an individual plan, you can still write off your premium. You just do it on your personal income tax return. So definitely check with the people around you that know those tax laws to figure out, is this going to gain me something? Is it not? Leading into tax law, you do have to be mindful for payroll deductions. Those are other things that if you're setting up for the first time, you're going to want to be aware of. Do we set this up on a pre-tax basis, a post-tax basis? We can work with you on what compliance documents would be needed if you choose to do things on a pre-tax basis. So there's a lot more than just picking your plan. And we wanted to make sure that we address just a few of those highlights, specifically in Texas, Senate Bill 51, and also in Texas, yes, we can do an owner-only group. To that end, I do want to mention one last item around that for employees. What you cannot do is choose to offer only to yourselves if you also have employees. So if you are a business that has, the two owners and you have maybe 5 W-2 common law employees and you want to offer benefits, you cannot exclude offering to those other employees. If you choose to set up a group plan, you do need to make it available to everyone. You have to have more than 100 employees before you could carve out an owner-only group and make it exclusive to just yourself. So just something to be mindful when you're looking at this. Next, I would say, what are some cost saving strategies? And there are things, depending on how many employees you have, that you could look at. There are plan design strategies. There are things called level funded and self-funded plans that Mylo would be happy to explore with you. In those situations, you can get up to 30% under the Affordable Care Act rates. But you do have to qualify medically for them. So you have to answer health statements. It's the way we used to do underwriting, way back in the good old days before the Affordable Care Act. But if you're willing to do that little bit of extra work based on the health of your employee population, you might be able to get better rates. So those are strategies and levers that we can pull and discuss as you meet with a benefit advisor if you are interested in exploring setting up a group plan. If you already have a group benefits plan and you're just not sure, are we in line with the market? What's the benchmarking? What are other people in my industry and area offering? We have the ability to sit down and do a market check with you and help you make sure that you're confident in the plans that you do have in place. How do we do all of this? I think that's a fun slide next. So the top rated carriers, we kind of touched on the fact that you'll see national carriers, but this is how we do it. This slide is all about, we have a digital quoting platform that's going to allow us to input your employee data, and we're going to pull back all of the carriers that are available in your area and what the plan designs and rates look like. So we'll be able to help you narrow down, a couple, 3 plan designs to look at from each carrier, and then figure out who's going to be the most competitive and the best fit for you and your employees. Once we have a plan design that we like, the next slide will show you some of that contribution modeling and budgeting tool that we discussed. Catt, if we can move forward one. So budget is a big part of offering benefits. And so on the right-hand slide, we have a snapshot of our contribution tool, which allows us to move some dials around and figure out if you are interested in offering and helping to cover some of the dependents, how is that going to impact your budget? So we can work with you on setting whether it's a percentage or whether it's a flat dollar amount. You just want to do a fixed amount because you're trying to really keep control of that budget and know what next year is going to bring. So there are a couple of ways to approach that when we get to that part of the discussion. So we will help you on budgeting and looking forward. We try not to have just a 1-year plan. We really want to work with you to set up, okay, what about next year and the 3rd year? Let's be looking ahead and planning ahead. So that's just a sneak peek at some of what we do when we are doing the digital shopping and budgeting. And the next slide shows you a sneak peek at what do my employees see. So this is some snapshots from your digital benefits enrollment platform. And in this segment, this is where an employee would go out and they would be able to shop for their benefits online. And they can do it at night. They can do it on the weekends if they need to have a significant other that's looking at this with them. It will keep track of the payroll deductions that will be coming out of their paycheck along the side. So they'll have a running total as they go through some of those benefits. And they'll be able to see real time when they add or delete a dependent, how is that going to impact the cost of what it's coming out of their paycheck. So this enrollment platform is available year round. A lot of times people forget, did I add my kids to my dental or did we not? And so they can go back in here, they can look and see what coverage do they have, which dependents are on it, who's the carrier in case they forgot. So it's always here. It would also be used for your open enrollment at renewal the next year. So we're trying to make it so employees take some of the administration on themselves, and you are not chasing down paper, you're not having to remind people, but you as the business owner and any administrator you designate will have access to see the entire system. You can pull reports for payroll deductions. You can pull reports because you just want to get a list of birthdays for your employees. There's a lot of data that is kept in this platform that can be helpful to you in other areas of your business. If you're interested, there are some additional items. This part of it is no cost, the benefits administration, but there are some add-on features if you wanted to add on some payroll connectivity, if you want to look at doing a fully integrated payroll solution. If you happen to be an employer that has more than 20 and you have to comply with COBRA, we have COBRA services that you can choose to purchase, and they will automatically integrate where you don't have to remember to key things into systems. So we're looking for those connections, the connectivity, and the efficiencies that make it so you have to do the least amount possible. So that's a quick peek at what the employees will see as they engage in that platform. And again, the benefits part of the platform is at no cost to you. We provide that at Mylo to our clients. I know I am coming right up on time. I do want to leave some opportunity for some questions. I think we did address the one question I saw earlier about husband and wives, but more.
We do have another question. Is it possible to cover 1099 employees?
Great question. So this is a two-part answer. The carriers will sometimes allow you to do that because the carrier is not the Department of Labor. The Department of Labor will frown on it. So when you cover a 1099 employee, you create something that's called a multi-employer welfare arrangement, and it requires lots of government forms that go with it and probably a headache you don't want. And the other thing to be mindful of is typically at the carrier level, if they do allow it, they only allow, maybe one or two. So if it's you and maybe a spouse that are the owners and your whole crew is 1099, that's not going to work. You would only be able to cover yourselves. So it's really a best practice to limit it to common law W-2 employees because there's no predicting, when the Department of Labor might ask, send a question or do an audit, and it's better to be on the safe side, in my opinion. So a two-part answer. The carriers will sometimes allow it, but you really need to be careful about doing that because you create a lot of compliance and complexity for yourself by doing so. Any other questions? 5-person team, all W-2. Trying to read the rest of this question. It's cut off.
So currently offering benefits to my 5-person team, all W-2s, that through QuickBooks and Intuit. They're integrated directly with my payroll via QuickBooks. Does Mylo's app integrate with QuickBooks, or would it be a manual entering?
So the Mylo Ben Admin platform has the ability to have some connectivity to QuickBooks, so we could take that offline to have a discussion about the options that you have there. There is an additional cost for it to have that integration. So I'm not sure what you're currently paying as far as the overall package. It would be something we'd want to take a look at. But ADP, Workforce Now, QuickBooks, Paylocity, ExecuPay, those are all some of the, if you have a cloud-based payroll provider, there are definitely some options for some connectivity. And what that means is if somebody quits and you terminate them in the system, it automatically sends an update to payroll deductions. So there's a lot of moving parts, as I mentioned earlier, in benefits. And so you want to make sure not only are you capturing new additions and terminations at the carrier level for your bill, but you also want to be adjusting the payroll deductions for any employees. Do we have any others? Okay. With that, I would like to introduce my colleague, Courtenay, who is the maven of Medicare. She knows all kinds of things about individual health Medicare, and she's going to take it from here. Thanks, Courtenay.
Hi, everybody. Nice to see you or hear you or see you listening to me. Anyhow, I wanted to go ahead and just kind of let you know a little bit about me. I am a senior health consultant with Mylo. I have been here about 6.5 years now. Prior to this, I was selling Medicare supplements, drug plans, and Medicare Advantage plans. And then I, like Sandy, kind of geek out over insurance, and you probably will never meet two bigger geeks than me and Sandy when it comes to this type of thing. But also like Sandy, I wanted to do more with talking about it, helping with it. So I kind of got out of the sales role. And now all I do all day long is talk about the pre-65 market, which is Marketplace, ACA, Obamacare, any name that you want to call it. And then also I speak to the Medicare side of things. So with that, we can kind of go ahead and get started with what Mylo offers as far as the individual health and Medicare products. Individual health is just that. So everybody's needs are different, and everybody has a different, different desire. Some people want low premiums with a higher deductible. Some are going to want a higher premium with a lower deductible, and it all depends on your usage. And that's what we're here for, is to kind of help you determine what is the best fit for your family and for you. And in some cases, maybe you don't fit into that group mold that Sandy was talking about. So what you want to do is give Mylo as a resource to some of your employees. So where we can help a lot is with those 1099s that you mentioned. If you didn't want to get into the MIWAs and all of the other federal regulations that Sandy mentioned there, you could offer Mylo as a resource for folks to pick up individual health care. We do offer major medical, which again is the Affordable Care Act Marketplace plans. Those are plans that there are no questions about pre-existing conditions. There is nothing that you need to, think about as far as, can I get the plan? The only thing you really need to worry about is, do you have an enrollment period for that? We also offer a short-term medical. Those are policies that are designed for a short period of time, anywhere, sometimes from 1 month on, up to 3 years in some cases. Those do not cover pre-existing conditions, and the prescription coverage that those plans have is a prescription discount program. So it's not like your typical prescription drug coverage that you're used to. And then of course we've got dental and vision coverage as well. And then on the Medicare side of it, we do offer Medicare supplements, which are your Medigap plans, Medicare Advantage plans, and then also your prescription drug coverage, which is your Medicare Part D. All of our agents that you would speak to when you're talking about this are going to know all about the enrollment periods, all about, what product it is that's going to, that, would fit for you. We do have a variety of carriers that we work with. There are, in Texas specifically, we've got Blue Cross Blue Shield of Texas. Baylor Scott and White has their own plan. Ambetter, Cigna, really anything you see here, with the exception of Kaiser, will be in Texas. But it varies by area, it varies by zip code. And then on the Medicare side, you're going to have all the heavy hitters that you can think of. So United Healthcare, Mutual of Omaha, Cigna, Humana, any of those would fit for you. So when you're thinking about what coverage to offer, I do invite you to not only explore the group side of things, but then offering Mylo as an individual solution for your group. So Catt, if you want to go forward. Okay, so healthcare and Medicare, and then some of the key highlights of this, and I understand healthcare is confusing to say the least for folks, because if you're somebody that's used to a group benefit, just like I am, you open enrollment comes around every year, you pick a benefit, your choice is what your choice is, right? There's not a lot of choices out there to go through. And so it's important that you understand, when you can be enrolling, what are you eligible for? And then what do you want to pick? Okay, so we'll go over all of those. If any of you or any of your employees are somebody that's come from a situation where they have COBRA available to them, you do have 60 days from the date of loss of coverage to enroll in major medical coverage. So if you're somebody that's coming off of COBRA or coming off of employment and you have the option of going on COBRA, you have 60 days from that data, from your date of loss of coverage, to enroll in the major medical plan. You also have, if you're losing COBRA, that's another qualifying event for you. So you would have 60 days from that date of loss of coverage to enroll in a major medical plan. I do want to point out, for those that are Medicare eligible or will be Medicare eligible at any point, and this is just one of those rules that nobody really knows about, and is very important to understand. COBRA is not considered creditable coverage when you are enrolling in Medicare Part B. So if you are on COBRA and you're coming up on Medicare eligibility, you want to make sure that you work with me or somebody like me that's going to help you understand what your enrollment periods are for Medicare, because they do not offer any sort of flexibility, I guess is probably the best word here. So when you're applying for Medicare Part B, you have a certain amount of time, depending on your situation, to get enrolled in Medicare Part B, but it is important to understand that you do not want to go on COBRA for that 18 months and then decide you're going to get involved with Medicare Part B. On the Medicare side, we do also have an annual enrollment period. Anybody that watches any sort of TV right now, and I watch just a bunch of junk TV, but I'm even seeing the commercials on my junk channels and my house channels that I watch. Right now is the annual enrollment period for Medicare. This is for folks that are enrolled in Medicare currently that are needing to make changes to their prescription drug plan or their Medicare Advantage plans. This time period is also for folks that are, they are maybe outside of an enrollment window that they had and had to enroll during the general enrollment period. So now they're enrolling in an Advantage plan or a drug plan. So any of you that might be watching TV or getting something in the mail saying you have to do something by December 7th, which is just a few days away from here, not to worry. If you're not already on Medicare, there's nothing you need to do. This is for folks that are on existing plans with Medicare. A special enrollment period. So special enrollment periods or SEPs exist for both Medicare and the pre-65 market. And a special enrollment period is any time outside of open enrollment when you have the ability to enroll in either your Medicare Supplement or Advantage plan and your Part B on the Medicare Advantage or on the Medicare side, or anytime outside of open enrollment on the pre-65 market that you can enter into an Affordable Care Act plan. This is typically, you know, generally speaking, on the pre-65 side, you're gonna have 60 days from your date of loss of coverage to enroll in an Affordable Care Act plan. Your special enrollment period, though, for Medicare can vary, and this is something that you want to talk with somebody who is licensed and understands all of your enrollment periods to understand what those look like for you, because they are different based on what kind of plan you're going to get. Another one that I want to spend a little bit of time that was kind of on the last slide that I didn't hit on that we're also in right now is the open enrollment period for the marketplace plans. So any of you maybe that are, you know, you either don't have coverage right now and are not looking to get into a group plan, or you know somebody that is not covered with benefits right now, now is the time to be exploring the coverage availability on the marketplace. And for the most part, this time period is going from November 1st through December 31st. There are some states, Texas is not one of them, that will go past the 12/31 enrollment date. But if you enroll by December the 15th, you can have coverage that starts on January the 1st. And again, that's open enrollment for the ACA. Another big piece of the ACA is the tax credits and subsidies. So this would be if you are in a household, either by yourself or with others, and the income is below a certain threshold, which is 400% of the poverty limit. Then you may qualify for a tax credit or a subsidy. This will vary by your zip code and your household size, just because everywhere has different poverty levels. And then household sizes obviously are different. The tax credit or a subsidy for somebody in a household of 2 is going to be very different than somebody in a household of 6. So always, you know, if you think you might qualify for a tax credit or a subsidy, it would be a good idea to, you know, gather what is your modified adjusted gross income projected to be for the plan year. So what your projected income for the plan year means is if we're looking at plans for 2022, what do you as a household expect to bring in on your taxable income? And then we can determine whether or not you're eligible for a tax credit or subsidy. Now, if you have affordable coverage available to you through a spouse or somebody else in your household, in some state, you know, in some instances, a domestic partner will count, you are not eligible for a tax credit or subsidy. And so what that means is that if you've got affordable coverage, they're not going to give you a break on the premium on the ACA for that. So it's important to understand that if you have the opportunity to enroll in benefits, so if somebody has worked with Sandy's group to put a group plan in place, and you decide, well, that seems pretty expensive to me. I don't want that coverage, or maybe I want to try a different carrier. Please just understand that because the coverage was offered to you, you are not eligible for that tax credit. And then Sandy also mentioned the networks on her plans. And this is where I don't make a ton of friends, but it is what it is. And I'm just working with what I've got, and I'm here to help you understand it. Like she said, the networks on the individual plans are very, very local. So they're very regional. So it is important that when you're working on this, that we look at doctors and hospitals to see just exactly who would fit with the plan that you might be selecting. And some people, what I get quite a bit is, well, I don't have any doctors, or I don't care where I go. I would ask that you do think about, though, if you are going to look at the individual market, please at least pick a hospital that you would be comfortable going to in an emergency situation. And the reason for that is obviously the hospital is going to be your biggest financial exposure. We want to make sure that if you have an emergency, or if you have some need to go to a hospital, that you're able to go to a hospital that you're comfortable going to. And then from there, we can look at doctors that would work for you. Another thing to do is understand that sometimes these networks are tight. And so we want to make sure that you have alternate providers or alternate hospitals that you might consider using. Just to give you, a for instance, in Texas, and it's kind of wild, but Baylor Scott and White, they have their own plan, but it's not accepted at each Baylor Scott and White campus. So it's very important that we check that, somebody checks the exact location that you would want to go to. And so when I'm working with clients, I always ask that they give me, for their physicians, I need a first name, last name, and I need their specialty, because a lot of names are the same. So first name, last name, specialty will ensure that I'm finding the right provider. And then as far as the hospital goes, we need the proper location and the proper name of the hospital. So when I say proper name on the hospital, I mean, and I'll have to use something here that's local just because I know it off the top of my head. Those of us that are here in Kansas City, we would call one of the major hospitals here KU Med. So KU Med may not mean much to anybody there, but to us, it means it's one of the biggest hospitals. It's a great teaching hospital. Anything cardiac, you want to go there. But you're not going to find it if you type KU Med into a directory. You have to know to put in University of Kansas Health System. So that's what I say when we need the proper location. So just when you're looking at these networks, please, please, please make sure that you get a good comprehensive list together, because the other thing that's available or not widely available would be PPOs. And even PPOs that are available, the cost for your out-of-network coverage is high. I looked at a PPO for somebody the other day. Yes, it was there. Their in-network deductible was something like $3,000. Max out of pocket was something like $6,000 for the family. But if they went out of network on this PPO plan, the deductible was $10,000 and the max out of pocket went up to $40,000. So sometimes it would behoove you to find doctors that are in network. But I know it sounds like a hammer on that a lot, but if you're going to get the coverage, you might as well have the coverage if you're in there. So I believe that brings us to the end of my part. So I'll take questions if you have them.
So we do have a question. If an employer offers affordable healthcare insurance for the employee only, but does not offer any cost sharing for the dependents or cost of the employer plan is not affordable, can the dependents apply for tax credit from the marketplace?
Yes, I would have to. I'm sorry, go ahead.
Does that make sense to you?
It does. It makes absolute sense, but that is also one of those kind of state by state things that I would have to look further into. I would be happy to do that for Texas. I just don't know off the top of my head. I believe that because it is not actually offered for everyone, they should be able to.
Okay, last chance for questions.
Awesome. Thanks, Courtney, and Sandy as well. Just such great information. I know we covered a lot today, specifically in those two verticals. As mentioned, we've had tons of interest when we first started, and we're at the Sun Belt, and then again recently in Austin as well. So 'tis the season at the end of the year. It's always a hot topic, but we definitely can assist, as mentioned, year round. And of course, if there's any other questions that come to, you can definitely reach out directly to us. I think Sloan already put the link to the benefits website to access everything about Mylo, but again, she can easily put you in touch with us if you have further questions or anything specific to your case. As totally understandable, sometimes you don't want to ask some of the questions because they become very personal. So, with that, we're just, really excited to bring this type of expertise to the TAB members and association. We're excited that we've been able to bring such breadth of that knowledge and product expertise to you. And again, like I said, we're here at any point in time to assist or help you through any of those questions that you want to reach out to on the side.
Thank you so much, Catt, Courtney, and Sandy, for your time today. It's truly eye-opening how in-depth the insurance can possibly be. And TAB is so proud to be able to offer this opportunity for our members to be able to take advantage of your services. Again, like Catt said, you can visit our website, the link's in the chat box, and get more information, or you can contact the TAB office to get connected directly with one of these ladies. Thank you for your time and hope everyone has a great day.